When a person crosses the age of 70, the body changes in a way that even the smallest routine habit can bring about serious consequences. One of the most overlooked but most dangerous habits is eating heavy meals late at night. The body's metabolism slows down with age, the digestive system becomes weaker, and the heart and other organs can no longer handle the same pressure they used to in earlier years. For someone over 70, a heavy or late-night meal can turn the hours of rest into a time of hidden risk, rather than relaxation. When food is consumed late at night, the body must work harder to break it down. In younger years, this process may not feel noticeable, but with age the stomach produces fewer digestive enzymes and motility becomes sluggish. This means the food remains in the stomach longer, leading to bloating, acid reflux, and even aspiration while asleep. Acid reflux at night is not just discomfort, it can cause micro-aspirations into the lungs, leading to respiratory issues or pneumonia in frail elderly people. Many cases of coughing during the night or sudden shortness of breath among seniors are linked back to late-night eating and the reflux it causes. Heavy meals, especially those rich in fats and oils, add another layer of danger. Fats take longer to digest, demanding more blood flow to the stomach and intestines. At the same time, the heart of a 70-year-old is often already compromised with some degree of stiffness in its arteries, hypertension, or even mild heart disease. Redirecting significant blood flow to the digestive system after a large dinner forces the heart to work overtime at a time when it should be resting. This strain on the cardiovascular system at night is one reason doctors often warn that heavy meals can trigger nighttime heart attacks or arrhythmias in older adults. There is also the matter of blood sugar regulation. Many older adults live with diabetes or prediabetes, and consuming carbohydrate-heavy meals before bed can cause sharp rises and drops in blood sugar. When blood sugar spikes during the night and then crashes, the brain and body react with stress signals, disturbing sleep cycles and even creating episodes of confusion or dizziness upon waking. In severe cases, nocturnal hypoglycemia can occur, which can be extremely dangerous for elderly individuals who may not recognize the signs while asleep. Another hidden danger lies in how late-night meals disrupt the circadian rhythm. The human body has an internal clock that expects certain behaviors, eating during daylight hours, resting during the night. When food is introduced too late, especially in large amounts, it sends conflicting signals to the body's internal clock. The digestive system begins working when it should be winding down, which can delay melatonin release and reduce sleep quality. For older adults, sleep is already lighter and more fragmented. Adding digestive stress to the equation makes it even harder to achieve the deep restorative sleep that is vital for memory, immune function, and overall health. Research also shows that people who eat late at night are more likely to experience sleep apnea or worsening of existing sleep apnea. This condition, where breathing repeatedly stops and starts during sleep, is particularly dangerous in older adults because it raises the risk of strokes, heart failure, and sudden death during the night. Heavy meals contribute to sleep apnea by increasing the likelihood of acid reflux and by adding weight around the abdomen that pushes up against the diaphragm, making breathing more difficult while lying down. Beyond the physical dangers, late-night eating also creates a cycle of poor habits. Seniors who stay up late to eat often find themselves watching television or scrolling through their phones, exposing themselves to blue light that further disrupts their sleep cycles. They may also wake up late in the morning with less appetite, leading to skipped breakfasts and irregular eating schedules. Over time, this irregularity weakens metabolism further, contributes to weight gain, and accelerates age-related decline. Doctors and nutritionists consistently recommend that elderly people keep their last meal of the day light, balanced, and at least 2 to 3 hours before going to bed. A dinner focused on lean proteins, vegetables, and easily digestible foods is far safer than a plate filled with fried foods, red meats, or sugary desserts. Such lighter meals not only protect the heart and digestion but also help improve the quality of sleep, reduce nighttime awakenings, and allow the body to focus on repair and restoration instead of being overburdened by digestion. For those used to late-night eating, breaking the habit may feel difficult, but it is possible with small adjustments. Instead of a heavy meal, a warm glass of milk or a small serving of yogurt can provide comfort without overloading the digestive system. Herbal teas, such as chamomile, not only soothe digestion but also promote better sleep. If hunger strikes late at night, a banana or a handful of nuts is a much safer option than fried snacks or sugary desserts. The case of the 71-year-old man who passed away in his sleep is a stark reminder that seemingly small habits can carry immense risks with age. While the cause of his death may appear natural, experts often emphasize that nighttime cardiovascular events are linked to diet, lifestyle, and bedtime routines. A stomach overloaded with food is not just uncomfortable, it can be a silent factor that tips the balance for a vulnerable heart or weakened lungs. Ultimately, the message is clear. After 70, eating habits must adjust to match the body's changing capacity. The evening should be a time of winding down, not forcing the digestive and cardiovascular systems into overtime. By avoiding heavier late-night meals, seniors can protect their hearts, improve their sleep quality, and give their bodies the best chance of living longer and healthier. It is not simply about comfort, it is about survival. Choosing lightness in the evening may mean the difference between a peaceful night's rest and a night that becomes one's last. As people grow older, the role of medication becomes increasingly important. For someone over the age of 70, daily medicines are often a lifeline, keeping blood pressure stable, preventing strokes, controlling diabetes, managing heart disease, or calming nerves. But this lifeline can also turn into a hidden danger if the timing and usage of medications are not carefully managed, especially before bedtime. What many elderly individuals do not realize is that the way medicines are taken at night can decide whether their sleep will be safe or filled with risks. One of the most common issues is taking blood pressure medications too close to bedtime. Blood pressure naturally dips during the night in healthy individuals, giving the heart and arteries a chance to rest. But when strong antihypertensive medicines are taken at night, the blood pressure may fall too low while the person is sleeping. This condition, known as nocturnal hypotension, can reduce blood flow to the brain and heart. In younger adults, the body may compensate, but in someone over 70 with fragile arteries, this drop can trigger fainting, dizziness upon waking, or in severe cases, a stroke during sleep. Families often hear about a senior who passed away peacefully in his sleep, but doctors know that sudden nighttime drops in blood pressure caused by mistimed medications are often a silent culprit. Another area of concern is diabetes medication. Insulin or oral hypoglycemic drugs are often taken at night, but if they are not balanced with the right meal or dosage, they can cause blood sugar levels to plummet dangerously low while the person is asleep. Hypoglycemia during the night is extremely dangerous because the individual is unconscious and unable to recognize the warning signs: sweating, shaking, confusion, or hunger. Instead, the episode may progress quietly into seizures, unconsciousness, or even death. Doctors repeatedly warn that elderly diabetics should avoid aggressive nighttime doses without proper monitoring because their bodies can no longer regulate blood sugar as efficiently as before. Sleeping pills also carry hidden risks. Many elderly people suffer from insomnia and are tempted to take stronger sedatives to guarantee rest. But the aging brain and nervous system respond differently to these medications. Sedatives such as benzodiazepines or certain prescription sleep aids may stay in the body longer than intended because the liver and kidneys metabolize drugs more slowly with age. This prolongs their effect, leading to excessive drowsiness, confusion, or even suppressed breathing during the night. For someone already dealing with sleep apnea or weakened lung function, this suppression of breathing can prove fatal. There have been countless cases where an elderly individual did not wake up in the morning simply because a sleeping pill slowed down their respiration too much. Even seemingly harmless medications, like over-the-counter cold or allergy pills, can become problematic if taken at bedtime. Many of these drugs contain sedating antihistamines which dry out the mouth, cause urinary retention, or raise the risk of nighttime confusion. Elderly individuals already prone to nocturnal bathroom trips may find themselves unable to urinate properly or may lose balance and fall while trying to get out of bed. Falls at this age are not minor. They can result in hip fractures, head injuries, or loss of independence. All of this stems from a small pill taken at the wrong time of night. Polypharmacy, the use of multiple medications at once, is another reality for those over 70. It is not uncommon for seniors to take more than 5 or 6 medications daily. When so many drugs interact inside the body, timing becomes critical. For instance, taking heart medications together with certain sleep aids can dangerously slow the heart rate. Combining painkillers with sedatives can suppress breathing. Even herbal supplements, often thought of as harmless, can interact with prescription drugs and cause unexpected reactions if taken before bed. Ginkgo biloba, for example, can thin the blood and increase the risk of bleeding strokes if combined with aspirin or anticoagulants, and melatonin supplements may interfere with blood pressure control. The problem is made worse by forgetfulness, which is common in older adults. Some seniors, worried they missed a dose during the day, take extra medicine at night to make up for it. Others, trying to sleep better, increase their pill dosage without consulting a doctor. This kind of self-adjustment may seem small in the moment but can have severe consequences. A double dose of blood pressure medicine may cause fainting in the night, a double dose of sleeping pills may stop breathing, and a double dose of insulin may push blood sugar fatally low. One way to reduce these dangers is to create a structured medication schedule under medical supervision. Doctors often recommend that blood pressure medications be taken in the morning so that any lowering effect occurs while the patient is awake and active. Diabetes medications must be carefully balanced with meals, and regular monitoring of blood sugar is essential before bedtime. Sleeping pills, if needed at all, should be used sparingly and at the lowest effective dose. More importantly, seniors should always have follow-up checkups to ensure that their medicines are working as intended and not creating nighttime hazards. It is also important for caregivers and family members to understand the risks. Many times, elderly individuals do not share how they feel after taking their medications, or they may dismiss dizziness or fatigue as part of aging. Families should watch for warning signs like excessive daytime sleepiness, confusion, morning headaches, or unusual behaviors during the night. These symptoms can be clues that nighttime medications are disrupting the body's normal rhythms or putting too much stress on the heart and brain. The tragic stories of seniors dying in their sleep often reveal a pattern upon closer examination: the presence of poorly timed medications, unmonitored dosage changes, or risky combinations taken before bed. These are avoidable deaths, but they continue to happen because the dangers of nighttime medication misuse are underestimated. Elderly individuals deserve peaceful and safe rest, and this can only be guaranteed if medications are managed with precision and care. The lesson here is clear. After 70, medications can no longer be treated casually. They are powerful tools that must be used with exact timing and balance. The difference between taking a pill in the evening versus the morning can decide whether the heart beats safely through the night or struggles fatally in silence. Medicines can heal and protect, but when misused at bedtime, they can turn sleep into a moment of vulnerability. Respecting the body's rhythms, following doctors' instructions, and avoiding careless mistakes can make the difference between waking up to a new day and never waking again. One of the most underestimated dangers for people over 70 is the habit of using TV, mobile phones, or other electronic screens right before sleep. For younger adults, late-night scrolling or watching television may feel like a harmless distraction, but in the aging body and brain, this habit carries consequences that can directly affect heart health, memory, sleep cycles, and even survival. After 70, the body's natural systems are far less forgiving, and bedtime is supposed to be a period of gentle winding down. When screens enter that fragile moment, they disrupt the very processes that keep the elderly safe and alive through the night. The biggest issue with screens before bed is the emission of blue light. Phones, tablets, and televisions all emit this type of light, which mimics daylight and sends signals to the brain that it should remain awake and alert. In younger years, the body may fight against this disruption and still produce enough melatonin, the hormone that induces sleep. But as people age, melatonin production already declines naturally. That means seniors are more sensitive to even small amounts of blue light. Looking at a phone or TV before sleep can virtually shut down the limited melatonin the body is still producing, making it difficult to fall asleep and nearly impossible to enter the deep, restorative phases of sleep. For someone over 70, losing that deep sleep means the brain cannot properly repair itself, memory cannot consolidate, and the immune system does not recharge effectively. Sleep quality is not just about rest, it is directly tied to survival. Numerous studies show that poor sleep in elderly individuals increases the risk of heart attack, stroke, and sudden nighttime death. When an older person stares at a screen until the last moment before bed, their nervous system is tricked into staying in a state of alertness. The heart rate stays slightly elevated, blood pressure does not dip as it should, and the brain remains in a state of semi-stimulation. This overstimulation, combined with weakened arteries or a frail heart, sets the stage for nighttime cardiovascular events. Many deaths that occur in sleep are not random but connected to disruptions in the body's natural night rhythm, a rhythm that screens directly sabotage. Another overlooked danger is cognitive decline. At 70, the brain is more vulnerable to memory lapses and diseases such as Alzheimer's or dementia. Sleep is the brain's opportunity to clear away waste proteins and toxins that build up during the day. If blue light and screen use prevent deep sleep, those toxins accumulate, accelerating cognitive decline. Night after night of scrolling or watching TV instead of allowing the brain to rest properly can, over time, push an older adult into more rapid memory loss and confusion. Families often think that memory issues are simply part of aging, but in reality, disrupted sleep from poor bedtime habits is a powerful factor that worsens the process. Screens also expose elderly people to another danger: emotional stimulation. News channels, social media feeds, or dramatic television shows can raise anxiety levels, trigger stress hormones, and provoke emotional agitation right before bed. For seniors who may already be dealing with loneliness, health fears, or depression, this emotional stimulation does not simply disappear when the device is turned off. Instead, stress hormones such as cortisol linger in the body, making it difficult to relax. High cortisol levels at night are linked with increased blood sugar, higher nighttime blood pressure, and restlessness. When stress and age collide, the result is not just poor sleep but an increased risk of fatal nighttime complications. Physical risks are also tied to screen use. Elderly individuals often keep phones by their bedside. The constant temptation to check messages or scroll creates fragmented sleep, with multiple awakenings during the night. Fragmented sleep prevents the body from completing the natural cycles that repair tissues and regulate hormones. Even worse, getting up in the middle of the night after prolonged screen use often leads to disorientation and imbalance. The eyes, already strained from the light, adjust poorly to dark rooms. This increases the risk of falls, which in elderly individuals can mean broken hips, head injuries, or life-threatening complications. A simple habit of keeping the phone nearby can therefore trigger a chain of events that end in tragedy. Another risk hidden in this bedtime habit is how it reshapes the body's internal clock, or circadian rhythm. At 70, the body's natural rhythm is already more fragile. Many seniors go to bed earlier and wake up earlier because of shifts in melatonin and cortisol cycles. Late-night exposure to screens delays the signal for sleep, pushing the circadian rhythm later. This misalignment means seniors may struggle to sleep through the night, waking at odd hours or failing to feel refreshed in the morning. The irregular rhythm also affects appetite and digestion, sometimes leading to late-night snacking, which creates further risks to heart and metabolic health. Doctors and sleep specialists repeatedly warn older patients to treat bedtime as a sacred, calm period. Instead of falling asleep with the glow of a television or the distraction of a mobile screen, they encourage practices like reading a physical book, listening to soft music, or practicing light stretches and breathing exercises. These activities do not interfere with melatonin production and help the body transition naturally into sleep. For those who feel lonely and rely on TV or mobile use as companionship, families can provide alternatives such as audio books, gentle phone calls earlier in the evening, or relaxing background sounds that soothe without stimulating. The tragic stories of elderly individuals who never wake up after sleep often have invisible triggers. Families may say, "He went to bed as usual, watching TV," without realizing that this very habit disrupted his body's delicate night balance. The overstimulation, poor sleep, and weakened systems combined silently during the night, leading to the outcome. By recognizing that screen use at bedtime is not harmless but dangerous, especially after 70, such tragedies can be prevented. The solution does not require giving up technology entirely. It requires boundaries. Seniors can still enjoy television or mobile use earlier in the evening, but screens should be shut off at least 1 to 2 hours before bed. Bedrooms should be dark and quiet, signaling to the brain that it is time to rest. Night mode or blue light filters can help, but they are not a complete solution because stimulation from content itself, news, arguments online, fast-paced shows, can be just as harmful as the light. True protection comes from creating a nightly ritual of calmness, away from digital stimulation. The lesson is clear. After 70, the body is no longer resilient enough to fight against the effects of late-night screen use. What seems like a small, harmless comfort can lead to disrupted sleep, higher risk of heart attacks and strokes, faster memory decline, and even sudden death during sleep. A glowing screen is not companionship, it is a thief of rest. By putting away the phone, turning off the TV, and allowing the body to settle naturally into sleep, seniors give themselves the best chance at waking to another morning. Protecting sleep is protecting life itself. And at this stage of life, there is nothing more valuable than that. As people cross the age of 70, even the smallest detail in their daily routine can influence survival, and one of the most underestimated yet crucial factors is sleeping posture. The way an elderly individual lies down at night can either support their breathing, circulation, and comfort or, silently, create dangerous conditions that may lead to serious complications or even sudden death during sleep. Sleeping in harmful or incorrect positions after 70 is far more than just a matter of comfort. It can directly affect oxygen levels, strain the heart, and increase the risk of accidents and chronic issues. One of the riskiest positions for seniors is lying flat on the back, especially if they suffer from sleep apnea, obesity, or respiratory problems. In this position, the tongue and soft tissues of the throat naturally fall backward, partially blocking the airway. In younger adults, the body might correct this with stronger breathing reflexes, but in older adults the reflexes are weaker, the muscles less responsive, and the lungs less efficient. This leads to episodes of shallow breathing or complete pauses in breathing, known as apneas. Each pause deprives the brain and heart of oxygen, and repeated interruptions throughout the night put enormous stress on the cardiovascular system. For someone with an already weakened heart, even a few minutes of poor oxygen flow can trigger an arrhythmia, heart attack, or stroke. It is not uncommon for sudden nighttime deaths in elderly individuals to be linked with undiagnosed or worsened sleep apnea exacerbated by back sleeping. On the other hand, certain side positions can also be problematic if not properly supported. Seniors often suffer from joint stiffness, arthritis, or fragile bones. Lying on one side without proper cushioning between the knees or beneath the head can strain the spine, compress the shoulders, and restrict blood flow in the arms or legs. For an elderly individual with compromised circulation, this restricted blood flow increases the risk of numbness, tingling, or even pressure sores. If the individual already suffers from poor balance, waking up with a numb leg or arm can lead to dangerous falls while trying to get out of bed in the dark. Sleeping on the stomach, though less common in seniors, carries its own set of risks. This position forces the neck into unnatural angles for extended periods, straining the cervical spine. At an age when bones are weaker and muscles less supportive, such strain can cause lasting pain or even nerve compression. Moreover, stomach sleeping restricts the natural expansion of the chest, making breathing shallower. Elderly individuals with chronic lung conditions like COPD, asthma, or heart failure may struggle even more in this position, leading to lower oxygen saturation throughout the night. Low oxygen at night not only causes restlessness but also increases the chances of heart failure episodes or confusion upon waking. Improper positions also affect digestion and reflux, a common issue in older adults. Many seniors experience gastroesophageal reflux disease, GERD, where stomach acid flows back into the esophagus. Sleeping flat or on the right side worsens this condition, allowing acid to travel upward and irritate the throat or lungs. Chronic nighttime reflux can cause coughing, choking, or even aspiration pneumonia when stomach contents accidentally enter the lungs. For a fragile 70-year-old, this can be life-threatening. Doctors often recommend sleeping on the left side with the head slightly elevated to reduce acid reflux and improve digestive comfort, but many seniors are unaware of this and continue with positions that harm their health night after night. Circulation is another critical concern. The elderly are more prone to blood clots due to reduced mobility, weaker veins, or existing cardiovascular conditions. Sleeping in positions that compress certain body parts, such as curling too tightly in the fetal position or keeping legs crossed, can worsen circulation. Prolonged poor circulation increases the risk of deep vein thrombosis, which, if a clot travels to the lungs, can be fatal. Proper sleeping posture, with gentle elevation and support, helps blood flow more evenly and reduces these risks. Another danger comes from the physical environment combined with posture. Many elderly individuals use multiple pillows, either for comfort or to help with breathing, but stacking pillows incorrectly can bend the neck at sharp angles, obstruct airways, and cause musculoskeletal strain. Some may slide into awkward positions during the night without realizing it, especially if they have restless sleep or use overly soft mattresses. Without firm support, the spine falls out of alignment, leading not only to pain but also to nighttime nerve compression, which manifests as sudden cramps or tingling. These cramps can wake seniors abruptly, sometimes causing panic or disorientation that leads to accidents. Caregivers and family members often underestimate how much guidance seniors need in maintaining safe sleep postures. It is not enough to simply say, "Sleep on your side," or "Use a pillow." Elderly individuals benefit from ergonomically designed pillows that support the neck, cushions between the knees to keep the spine aligned, and slightly inclined beds or wedges that help with breathing and reflux. Even minor adjustments, like elevating the head by 20 to 30 degrees, can significantly reduce the risk of airway obstruction and acid reflux at night. The tragedy of many elderly deaths during sleep often masks the real triggers. Families may believe their loved one just passed away peacefully, but in many cases, an unsafe sleeping position played a part. A back sleeping posture combined with sleep apnea, or lying flat while struggling with acid reflux, can quietly create conditions that the body cannot recover from. These silent dangers highlight why posture is not just a matter of comfort but of survival. It is equally important to consider that improper posture not only raises the risk of sudden events but also affects long-term quality of life. Chronic pain, morning stiffness, headaches, and fatigue all stem from sleeping in the wrong way. Seniors who wake up feeling tired despite long hours in bed often blame aging, but the truth may be that their sleeping position is preventing the body from resting properly. The elderly body needs every opportunity to heal and recover during the night, and poor posture steals that chance. The solution lies in awareness and deliberate adjustments. Seniors should avoid lying flat on their backs for long periods if they suffer from breathing difficulties, and they should not curl too tightly or lie on the stomach. Instead, side sleeping, particularly on the left side, with proper support for the neck, spine, and knees, offers the safest option. Adjustable beds, wedge pillows, and firm but not overly hard mattresses can make a significant difference. Caregivers should regularly check how their loved ones are positioned at night, especially if they wake frequently or have chronic conditions. Ultimately, after 70, sleeping posture is not a small detail, it is a life-preserving habit. The body is more vulnerable, the organs more fragile, and the risks higher. Correct sleeping positions allow the lungs to breathe fully, the heart to rest steadily, the stomach to stay calm, and the spine to remain supported. Wrong positions, on the other hand, may turn sleep into a silent danger. By respecting the importance of posture, elderly individuals can transform their nights into a time of true healing and give themselves the best chance of waking to another morning. It is not just about lying down, it is about lying down safely, with awareness that the way one sleeps can mean the difference between health and harm, between rest and risk, between life and death.